Welcome to another episode of Smiles in the Air, your oral health and prevention podcast. I'm Celso da Costa, and today with me I have a star from Dentistry.
You're making me blush.
So, you know her, of course. She's the practice owner of Chelsea Clinic. She's also one of the co-founders of the Parla that we have here on our table.
Yeah.
So, welcome, Rhonda. How are you today?
I'm really good, thank you. Came all the way to Geneva because it was insisted I had to be here physically in person for the podcast. So I'm doing good.
Now it's always better to see each other.
100%.
Yeah. So tell me a little bit, because we were discussing before off the record. It's since 2019 that we are not face to face.
Yes.
So we had COVID in between. You had business also blooming. You were in TV a lot too.
I try.
So tell me a little bit, what's happening since 2019?
Oh gosh, so 2019 was obviously a year where we had no idea that the year after was going to change all of our lives. I had been trying to buy the practice Chelsea Dental Clinic. So if we rewind, I qualified in 2010. I started working all over London, well, not London, actually, all over the UK as part of the NHS and different practices. And all the practices that I was working in, they were very much the drill, fill, pay the bill kind of dentistry. What I say is, the sort of basic need practices. I was very jealous of my, at the time, person I was living with. He worked in a dental practice that was seeing a lot of private patients, had private potential. And the reason why I liked it is because it gave you the opportunity to do very high quality dentistry. So what I did was I started going on all of the courses that he was doing, and I take it back to my practice that didn't have those kinds of patients. And what I'd say is, why don't you think about doing this and this? And I built up a portfolio. Then I started CV dropping all over London, and I just said, I want to get back in London. I'm sick of living in this little village in Kent. I need to get out. So I eventually got a job in High Street, Kensington, in a mixed practice, NHS and private. And my boss at the time was trying to sell his practice in Chelsea. It had changed hands about 5 times.
Wow.
And no one could make it work. There was no patient list. And so the problem is in the UK as well, within healthcare, it's very difficult to build up a list, to build up, a following of patients that are going to believe in what you're talking about, because they're also used to having free healthcare. So I decided to try and make the practice work. I worked with his daughter, who at the time was practice manager. I built a list of patients from Instagram and Invisalign. So I call it like the 2 eyes. And I basically created it from being a practice that was seeing 1 patient a month to now being a team of 23 and fully booked for 6 months. So that happened. But saying the wow, I completed on buying the practice a week before national lockdown. So that was the really difficult thing. And I think, it really shows you that even though you think you've overcome one hurdle, more hurdles come at you. And you have to just really learn how to pivot and how to come, at these challenges. So for me, I had to understand what we were going to do. It was really scary because they said dentists can't work, the doctors could work. And we were sat at home and I was like, I have this big loan. I've just taken over this practice. What am I going to do? So that was a really challenging time, 2020. And, we were in and out of lockdown. There was a lot of rules imposed on us. We also launched Parla as well. So as you said,
2020,
the eco-friendly brand. Yeah, exactly. And so I had to juggle all of that. So it was a lot, it's a lot. And I think it's probably now in the last year that I'm still kind of coming to grips with the difficulties of being a practice owner, because in 2020 and 2021, I was really in survival mode, if I'm honest.
And now you are just expanding, because I'm following you on Instagram, you know that.
Yeah.
Sometimes I send you some text like, wow, this is really cool. What are you doing now?
Thanks.
And I see that even if there was a lockdown, even if you were a little bit more fearful when you bought the products and all of a sudden everything is in lockdown, you will never stop. And you profit from this maybe lower moment that you had some doubts. But what I saw is that you were even stronger, because we launched the Parla with Simon and with Tanki, right?
Yeah, with Arash
So-
Tanki, yeah.
And why have you launch the Parla? Like we said, that is eco-friendly. What is so different from other toothpaste?
I think that one of the things that EMS has massive alignment to when it comes to Parla is, a mission-based company. So you guys are mission-based because, you said like, here's a problem. The solution to the problem isn't good enough. So we're going to provide a better solution, and we're going to like create our own community of professionals to be behind this mission. And I think that's exactly what we do with Parla. So the reason why we started Parla is because a lot of the big brands and a lot of the kind of conglomerates, they were like, okay, we want you guys to be the face of X, Y, and Z. I'm not going to name it. And at some point, Simon said to me, all these brands want to pay us to be an ambassador, but I think we should start our own thing because plastic's really bothering me, and toothpaste tubes are made out of single-use plastic and it takes 500 years to decompose, and that's just not good enough. And I have 2 little children now, and how can I go about my daily way knowing there's going to be more plastic in the ocean than fish? Like, I can't really live that way. Then I'm very much into ingredients, what you put in your body. I'm always telling my patients about sort of holistic care, like functional medicine, stress, mental health. And then I'm like looking at the ingredients on toothpaste. I'm like, this stuff isn't good for you. Some of it is not good. You wouldn't even use it in skincare, let alone put it in your mouth. The mucosa is so absorbent. So we created Parla, which is a dehydrated toothpaste sold in reusable glass jars, only clean ingredients, and we have also like a community of dentists that are behind us and patients. And then we've gone on to develop it further. So the mouthwash is, it's got oral probiotics. So it's kind of tipping it in favor of the good bacteria. As you know, it's all about the bacteria. So it's not about getting rid of the bacteria. It's about making sure that we have the good bacteria and less of the bad bacteria. So we continue to develop it as like an oral care range. It's not just about sort of being a toothpaste. It's about oral care as a whole. And we're still on this journey. So it's very hard because you're changing someone's habit of a lifetime. As you know, even when you guys started EMS, people are used to one thing and you're telling them, no, it doesn't work that way.
It's not really this. Maybe we can do better.
Yeah, exactly. Yeah. So that's really where we're at with Parla.
Yeah, exactly. And that's what I like about you guys, because you saw a problem that exists and you try to solve it. And you launched the Parla in 2020 when we launched also the aluminum bottle for the plus powder.
Yeah.
Because we want to get rid of the plastic.
Correct.
So I said, wow, they are really aligned with us.
Yeah.
So that was a good moment. And I'm seeing that you are quite successful. I was recently in the UK and I saw your Parla toothpaste.
In the airport?
Yeah.
Love it, yeah.
So, of course, I bought one.
Yes, amazing.
To test it. So it is really, really nice. But where are you going with Parla? If you can disclose something.
So I think that's the really important question. Like, why does anyone start a business? Why does anyone start? And I think the most important thing for us was having a mission that we were all aligned with, and it was being about oral care for the next generation. So for us, it's about really changing the way that people view their entire oral health. So from flossing to brushing. So I can't disclose obviously our new product range, which is going to come out, but we are continuously expanding and growing, and our new products that are coming on the market is going to address everything from oral health to overall health, because the mouth is the gateway to the rest of the body, right?
Yeah.
So I think that we really want to change that. And, obviously that's our primary focus right now with the business. And it's difficult. It's way harder than a practice. And I think as healthcare professionals, we're taught, you go to dental school, medical school, whatever, you get a vocational degree and then you get a job, right?
Yeah.
We're not in the same position as other people that do other jobs. My sister's an architect. She loved art. It took her really a long time to get to where she wants to be. A startup is a bit like that. Like, you start, you've got a passion. You don't know where it's going to go. You do have some structure in place, but you've got to constantly pivot. So it's just a completely different sort of game, really.
I'm reviewing myself on your words, because that's what I say to people. If you see a problem, act about it and do something. And that's what you have done when you acquire your practice. That's what you have done when you launch the startup with Parla, with your the other 2 co-founders. And not only that, I saw also that you launch a way to help other dental professionals to boost their business.
Yes.
Can you talk a little bit more about it? Because I'm curious. Honestly, I saw just a video that you were just a girl boss. Like, I'm gonna help you, and I'm here to help you. And
Dollar Shave Club, I stole it. You know, yeah, yeah. Okay, so you're talking about the academy, right?
Yeah.
So it's funny that you said, because at the beginning of the interview, you said like you never seem like you stop, like you continuously seem to be doing things. And I think like, if I'm transparent, it's probably a bit of imposter syndrome. It's that feeling that you think you're not good enough and therefore you do more in some way to prove to people that you're worthy of what you do, you know? And I think that, you know, we all have that to a certain degree, but teaching is something that I got asked about quite a lot, but I always thought from the very academic people that I wasn't good enough. And the reason why I thought that I wasn't good enough is because dentists and medics think in a very different way, and my brain is somewhat creative in the way that I think. You know, I'm very disciplined, but I'm very I'm the ideas person. I have a vision. I'm not the logistics. I don't like spreadsheets. I don't like PowerPoints. You know, I'm very much like the overall vision, or like I have ideas to do like content and things like that. So that's, I think, been difficult for dentists to resonate with. And I think part of me was like, well, I don't like have like a million papers to cite, and I don't suddenly know like the microns of like this, you know. And, you know, there were people that were still asking me, and I suppose that, you know, there was really that group of dentists that wants to learn and want to have that pathway to success. And it isn't just about learning like the enamel structure or like how to just do a prep to such precision. It's actually about the different things, you know. So the parts of dentistry that I teach is about like being ethical, but also having clinical skills that make you safe, you know. So it's about being safe to the patient. It's also about the communication skills. It's also about how I built a team and how I effectively outsourced to do the things that I want to do. So it's an online course. There's various modules. We add to the modules. It's all live. It focuses on the things that I do. So like bonding, veneers, consultation process, Invisalign. And it really gives people a really easy way to digest, to do things, and top tips and tricks. And then some people they sort of paid to go on to tier 2, which means that they get shadowing experience, one-on-one experience, access to my WhatsApp, so I can like go through the cases with them and so forth. And yeah, it was really lovely to see that so many people like took it up, you know, like especially a lot of female dentists, which I think was really interesting because there's so many leaders when it comes to dentistry, but they're often in the male sphere, you know. And I think that the younger females, they kind of want to see another female that they feel there's just a bit different and they can talk to and do different things and sort of emulate that.
People want to have examples to follow.
Yeah.
And you are a good example. And I need to say that even my wife follow you on Insta, and she takes you as an example. And sometimes she's the one showing me the stuff.
Oh, thanks.
Also, what is good. But I think it's a little bit what you said before. People think that successful people think that they are the best, but we don't.
Not true.
Yeah, we are always doubting ourselves and trying to prove others. No, I can do more.
Yeah.
Or I can maybe not be on the top now, but I want to be, and I can follow.
Yeah.
So I can feel that. And having you as a role model to other female dentists it's just good.
Yeah.
It's just good, and I like that. And I think the world will belong to women. It already is. I have 2 girls at home and my wife.
So you feel strongly about it?
Yeah, for sure. They have a strong personality.
But you know, I have to challenge you in some sense, because I think it's not about, for me, it's not even about like one sex dominating the other. I think it's so important for like integration, because I think that like regardless of what gender you are, we have our strengths and weaknesses, and it's actually when we put them together that we'll perform much better. And I think what's happening now is that actually we're creating more isolation and segregation, and we're trying to say like we're exactly equal in every single way, when actually we say like, no, people have strengths for this reason, and this reason. We should create equal opportunity, and we should let everyone's strengths come together. And that, I think we have a long way to go for that, but that's really what I'd love to see in dentistry, rather than like you've just got like one sect here. They're kind of fighting with who could do it better, but rather working together.
I completely agree. world is not black and white, it's color.
Yeah, I love that.
Right, so
I love that.
I think that's the point. Is not because he's female, not because he's male, is because they have the skills.
Yeah.
The truth is, what I feel is that since the world is more open to have the dentists, and we see that 80% of the students in dentistry, they are from the female side.
Yeah.
I don't know, but I think we evolve faster.
Yeah.
I need to say this because we are in the mean that when we are sitting as a patient in a chair, we need someone that's make us comfortable.
Yeah, of course.
Something that is caring.
Yes.
And for me, that's what I feel when I have, for example, who treat me is always the same person, and it is also a woman. And I don't know, she just make me feel safe.
Safe. Yeah.
That's the thing. It's not because he's a woman. I need to say this. But because brought some other design to the clinic, to be honest, it's not this cold. I remember when I was like 8 years old going to the dentist, and the dentist was like screaming at me, and I was in a room completely white and a super uncomfortable chair. And now we go and we have the example from our GBT launch. It's a pink chair. It's colorful. It's nice.
Yeah. I think it's like, I think what you said, it's all about the feeling. And, you know, there's the really famous quote, people don't remember what you did, how you did it, but they remember how you make them feel. And I think that that's something that's really important. And I think that as I saw a quote the other day that like it really stuck with me, and it said, when a doctor says, because a lot of doctors or dentists say, don't confuse your Google search with my medical degree. And, you know, it says, don't confuse patients' intuitive feelings about their bodies with your medical degree. And it was talking about like the medical industry gaslighting other patients basically. And it was like, you know, a patient comes in with you and they might describe symptoms, and just because you can't see it physically or diagnose it doesn't mean it doesn't exist, because actually it's so multifactorial. And I thought that that was really important, and that's one of the reasons why I love dentistry. I love dentistry because it gives me the opportunity to talk to a patient and understand their psyche, you know, who they are, you know, what's their stress like, are they happy, you know, what's their traumas, you know, like, and then it affects the treatment you do.
Yeah, I agree with that. I always tell mostly to my team that now when we are a clinician, we are not the source of all knowledge, it was in the past. The patient comes with a lot of knowledge. We are the ones that can guide them through the good one and the bad one.
Yeah, exactly.
So we are the educators.
Yeah, for sure.
To say. Really nice. So we met in 2019, and I remember quite well because I was invited at the time to help a UK group on the hands-on. And I came to the training room, and were you there? You were there with some other clinicians, and I was trying to teach the PS on PS, if I'm not mistaken, at the time.
Oh my God, your memory's scaring me. Go on.
Like what I want to ask now, there was a lot of difficulties with the PS on PS inside that group. I don't think that it exists anymore because we have a lot more information. But how did you apply GBT in your practice?
So Anna is somebody. Do you know my relationship with Anna?
Anna Middleton, of course. But I love
she's amazing. Everyone loves her.
Every single time that she see me, and I interview her in the podcast too. And I was with her in Manchester last weekend.
Yeah.
And every single time that she sees me, she says always the same thing. How are you, darling?
Yeah.
And us is like, okay, yeah, you are the only person that can tell me this outside my wife.
Yeah, I love that. She's so amazing. But Anna started off being my nurse. So when I was working in my NHS, when I was working in my NHS practice, Anna started out as my nurse. And then what she did is that I said, you know, like, you need to do something. You're amazing. I just saw that she was a star. So she went off and did hygiene and therapy. And then I brought her to Chelsea to work there. So Anna and I have been known each other for over 10 years. But Anna's always been really driven and really incredible. And she built this really strong brand. And basically, she loved everything about EMS, GBT, etc. And she's the one that introduced, and she's like, this is going to be a game changer. And to be honest, I just really trust her. That's how it started. And I said, great. And she was like, listen, I'm going to bring you on board. They trust me. They wanted to know which dentists would be good. Like, we need to bring this to the practice. And she basically, was one of the sort of like movers and shakers with EMS. And like, when we came back in those days, and she like introduced it. And now because all my patients are like, oh my gosh, it's like the least painful clean I've ever had. And it removes the stains and it feels amazing and it tastes good. That was it. We just kind of continued on from there. And, we're all about that patient experience with minimum harm. And, that's the ethos that you really promote. So it suits our practice, especially because our practice as well is a lot of cosmetics. So as well, it like doesn't damage the work that we've done, like veneers, bonding, implants, crowns. It's super important.
Well, I'd be afraid only to think that you and Anna are in the same practice because
fire.
That's the thing.
Although
how the other ones can keep up with you?
I know we barely see each other at work. I don't know. And there's also Sarah as well, who like the three of us have been working together for years. So we're kind of like the trio. But we have a lot. Most of my dentists are actually all my dentists, apart from one, apart from two. I'm like, my team is so big now. Are all male as well. So it's like we have a nice mix of like really good, like strong characters and personalities.
I need to pay you a visit next time.
Yeah, 100% when the refurb is done.
Yeah, okay. Tell me when. I will
January,
be in
London.
January?
Yeah.
Okay, I will be there. No, but again, I'm trying to imagine you guys working. So just for me, it will be tough to keep up.
Yeah.
So I imagine the rest of the team. So tell me, what's next?
Wow. So what is next? I think really, so I've been doing a lot of media facing stuff, which I enjoy. The reason why is because I like to connect with so many members of the public. So at the moment, UK dentistry is an all-time low. People don't have access to a dentist. So being able to go on TV and sort of provide tips for them, build that sort of thing is really important to me, because then I can help people that are across the other side of the country and can't afford to go to a dentist. I'm working only 3 clinical days, and for me that's enough. I really enjoy dentistry, like I'm really zoned in when I'm in there, but it's enough because then it allows me to focus time on things like Parla and also like mental health. I spend a day doing all the pampering stuff, like massages and like, meditation and exercise.
It is important.
It's so important, especially because dentistry is such a difficult career, the highest suicide rate. And I think it's absolutely key that we look after ourselves as professionals. And I was having a conversation with my doctor friend that came with me today, and I was saying, I think, because it is our responsibility to give as healthcare professionals, it doesn't mean we have to be a slave to the system, because if we can't look after ourselves, we can't look after our patients. It's as simple as that.
Agree. Agree. You touch a point that it's really touching for me, because I know so many clinicians and I'm traveling so much around the world that, of course, we know some stories and people that are trying like to quit dentistry. And I always think, why are you quitting dentistry? Dentistry is so fun, but it's fun when we also take the time to take care of ourselves.
Yeah, 100%.
And you had a nice point. In UK, the suicide rates in dentistry is so high.
So high.
And sometimes we don't understand why. And the general public can think, but they have a nice work, they have a nice pay, they have a nice life. Why are they complaining about? No, most of the times we don't talk because the patient cannot talk.
Yeah.
Right? We are always checking this, looking into, like Mr. Bin said, we are looking into darkness.
Yeah.
So how can we improve our mental health at the same time and be part of it? Like you were saying, like pumping you up is a good way to do it.
I think it's like self-love, but also on top of that, I started a podcast on mental health as well, and we explore the subject. It's with one of my friends who's a co-dentist, and we explore it, and I invite people on the podcast that are not dentists, and the idea is they can provide tips to people that are dentists where they've come out of darkness too. And I think that like it's hard because I think that within the medical profession as a whole, like we view ourselves as healers, like we have to heal. So I think there's a stigma attached to us saying like, I'm not well, I'm not doing good, I can't cope, like there's almost like, I don't want to say ego, but there's just a shame attached to it, And I think that that's the really difficult thing. I also think that, is that there's so much red tape around our profession. You know, we have so many governing bodies and so many legalities that also as well, you're just afraid of sort of expressing your own mental state because you're worried about all those eyes on you and people. And, you know, I think there's difficulty. And I think that one of the saddest things as well is real lack of community within the dental profession. You know, dentists don't want to help each other. You know, we should be encouraging each other to, and I think social media has created that rift even more. So like, for example, like you were saying, people might see someone doing well online, but they don't want to be happy for them or learn from them. They want to see them go down because they have this like nature. And again, it's like, no, you're a dentist, you're a doctor, you can't be showing yourself like this. You just need to show teeth and rub a dam and that's it. Or like before and after EMS, you know what I mean? That's it. And they don't like it. And I think that that's the really scary thing. So I think it's so important that if we're going to bring those suicide rates down, we need to start treating each other as human beings.
I like how you talk.
Yeah.
That's you needed to come to this podcast. Like it's great. I completely agree with you. I think it's changing. I think the dentist community is building this young generation. We are young, of course.
I'm old, but it's okay. I'm over it now, you know?
No, you're not as old as me, that's for sure. So, okay, but I feel young. Let's say that. But we are trying to shift that. And showing support, and even if we have some dentists that say that we are the Instagram generation because we post so much or we share so much that we will be blamed, like you said, sometimes by having fun with it, but who cares?
Yeah, no, I hear you. I mean, it's difficult, right? Because again, I would love to say who cares, you know, but the dark, dirty secret of being online is that you care. That's why you're online.
Yeah.
Because to some degree, you want the validation and you need the people to tell you you're doing a good job, right? And we know that because we know that the validation is what gives people dopamine. And that's why we are a slave to Meta now, you know, because, you know, we know, oh, well, like that did well. I must be doing something right, you know. So I think, you know, we can say who cares. And it's so wonderful, you know, when you meet people objectively, they're like, you're doing a great job. And you're like, am I? You know, like, am I? Because sometimes I don't feel like that, you know. And I think, you know, the main thing is as I said to you, is all about mission. And, you know, for me, like that, the mission stuff with social media is just really reaching as many people as possible to make them feel happy and safe and provide like information that's useful. Yeah,
I think it comes to the same thing that we need validation. That's why we do so much. But I agree with you. I use my social media in a way that I want to share my mission.
Yeah.
So I want as many as I can to share the same values, the same mission, the same vision that is a world without oral disease.
Yeah, for sure.
So how can we do it if we work together?
Yeah.
So it was so nice to have you on the podcast.
Thank you so much.
But I needed to invite you to the podcast to see you face to face.
I know.
This is crazy.
Am I a catfish or do I look like I do on my social media?
No, you look exactly the same.
Good, that's good to know.
So that's always good. And by what I remember, the last time that we saw face to face in 2019, you look better.
Oh, thank you. Okay, thank you so much.
Always better.
Thank you.
So thank you to all the listeners too. And don't miss the next episode of Smiles in the Air podcast. Subscribe in any platform that you hear the podcast. Can be Spotify, Apple Podcasts, or even on YouTube. And we will have other guests. Let's see if as good as you.
You're going to be better, I'm sure.
But see you next time. Thank you. Thank you again.
Thank you so much.